Hello again. My name is George Feiss, and I would like to introduce uh, Evan Smith, the president of Friendship Heights Neighbors Network. Evan?
Thank you, George. I'd like to welcome everyone, members and volunteers especially, from FHNN, Little Falls, and other villages, as well as those who have not yet joined the village. For those unfamiliar with the village movement, we're neighbors helping neighbors to age in place, and lead fulfilling lives. Special thanks to Margaret Walker, Marketing and Operations Director of Little Falls, for helping to promote this program. Now, let me introduce Dr. David Rabin, an FHNN board member and the former chair of Health Services Research at the Georgetown School of Medicine. He will introduce the speaker, Dr. Rabin.
Thank you, Evan. Many of us did not purchase long-term care insurance, as only 16% of those 65 plus have such insurance. Perhaps many of us at this point are interested in the opportunity to have assured coverage for long-term care, perhaps because we're living longer than we expected. We've lost a spouse, we developed a chronic disease, or now are committed to remaining independent in our home, but realize that in order to do that, we're going to need services brought to us at home at some point. So we may be rethinking the issue of getting assured, or the need to have assured long-term care provided to us at home. Our speaker today, Amanda Young, PhD, will describe continuing care at home programs, which have been developed over the past 35 years in the States, which can provide such insurance to us. One such program was developed several years ago in our area by Godwin House of Alexandria, Virginia, for residents of Northern Virginia and DC, but not us. In 2022, as executive director, Amanda initiated a continuing care program in Baltimore for Wesley Incorporated, a long-established nonprofit provider of care for the elderly in Baltimore, with the intent of expanding the program to all of us who are residents of Maryland. The program provides, as she will say, the assured access that many of us would like. Amanda Young has a master's degree in gerontology from McDaniel College, a PhD from Concordia University in leadership and gerontology, and is an adjunct professor at the University of Maryland, Baltimore, in its gerontology and thanatology program. From 2017 to 2022, before coming to us, she directed the Lutheran at Home program in the state of South Carolina, and was successful in expanding its program throughout the state. Amanda, we look forward with great interest and hope for your success.
Thank you so much, Dr. Rabin. I appreciate that introduction. Hopefully, I can, live up to it and that everyone enjoys the presentation. I'm going to share my screen here in a moment. I just wanted to remind everyone that I am going to share the PDF of this presentation and happy to do so. Also, my contact information. So if you don't get your question answered today, happy to answer questions via email afterwards. But I know you can go ahead and throughout my presentation, shoot those questions in the chat feature. We'll be answering those when I'm finished. So be happy to do that. So I'm going to go ahead and get my presentation going. And as David mentioned, I am the executive director of the Wesley Inc. That operates Wesley Secure Care, which is currently the only continuing care at home program in the state of Maryland. But I have a lot more to cover today, and what I'm going to go into is not only about continuing care at home, but I wanted to also talk about some facts and statistics about long-term care, what it costs if you're not familiar, because that's also very important, and really just more in general about the history of continuing care at home and what it is, continuing care at home here in Maryland, and then how it works and how our program works and what the future holds. So with that, some of these statistics for long-term care probably look familiar to you, especially if you are reading a lot about the subject, are researching options. You've probably heard these before or read them. So someone turning 65 today has about a 70% chance of needing some type of long-term care in their lifetime. On average, women need care for much longer than men because women tend to outlive men. So we need care for closer to 4 years, where men need care for about 2. However, about 20% of adults need long-term care for longer than 5 years. And I always give the personal example of, my grandmother lived to well into her 90s and spent about 10 years in assisted living. That is becoming more common today as we live longer. And so there is a great chance that a lot of us are going to see need for care. However, fewer than 3 in 10 people have actually planned for future care needs. So I applaud all of you who are attending this presentation today, because I'm hoping that you're attending this because you're thinking about long-term care and you're planning ahead and you want to make a plan. So I applaud you for that. And most of us, almost 90%, people want to age in place. And I'm going to tell you that you need a plan to do that. You can't just say it and wish it into existence. I see it all the time. So you need a concrete plan, a realistic plan for that to happen. And so if you don't take anything else away from this presentation today, which I hope you'll take a lot away, but I hope you take that you need to have a plan. And so that is the most important. There are a lot of options available to help us plan for the future. And one of those that David mentioned was long-term care insurance. This was a very popular option in the late 90s and early 2000s for a lot of individuals. And they purchased policies. And now what we're seeing is a lot of premiums are increasing very drastically. And insurance companies are offering a lot of options for people to decrease benefits, to decrease their premiums. And I hate seeing people make choices that aren't the best. So I always encourage people, if you're someone that has long-term care insurance and you get one of those letters and you want to decrease your benefit, to decrease your premiums, talk to someone before you do that, who knows what they're talking about. Because some people do that and then have a policy that's not worth what they're paying for. And so I encourage encourage you to talk to an insurance provider or a professional before you start making any changes. And also to let you know, as a nonprofit, part of our mission, we do complimentary long-term care insurance reviews. Most people purchase these policies, put them in their filing cabinets, and haven't looked at them, and they don't understand the fine print. We sit down with individuals and help them understand what it is they have, and maybe what they don't have. And so that's really important, especially as you look at continuing care at home and how it can and cannot work with long-term care insurance. Continuing care retirement communities or life plan communities, another very popular option. But of course, that involves you moving from the home that you may love into a larger community. People may say, you know what, I am going to private pay or pay as I go for care. I'm going to tell you that's not really a plan. So I'm going to encourage you to find a vehicle to pay for that care because I'm going to share some costs with you. And if you don't already know, it's really expensive. Another thing that I hear frequently as I talk to people in the community, people say, well, my daughter, my son, my niece, my nephew, they're going to take care of me. But have you had a conversation with them? Because a lot of the times we haven't had those really important conversations with the people that we're thinking are going to take care of us in the future. And I will encourage you to have realistic conversations with those people because getting your medication and maybe cooking a meal for you is very different than having to give you a shower and getting you to the bathroom and wiping your behind. So thinking about that versus, having your son or your daughter, cook you a meal. And so again, having those realistic conversations, because just because your daughter is a nurse Monday through Friday doesn't mean she wants to be a nurse to you on Saturday and Sunday as well. And the other thing that commonly happens too, and I have to kind of bring people to reality is people say, well, I don't have that many family members around, but I have really great friends and they take care of me. And I say, well, that's wonderful. How old are your friends? I bet you that they're same age as you. And they are. And so you really have to make sure that you've got some backup plans there as well. And I'm so excited that now Maryland is going to have this new option available almost everywhere in 2025, the continuing care at home that you're here to learn a lot more about. And so let's talk about the cost of care here in Maryland. And so Genworth is an insurance company, and every year they do a cost of care survey, and they get what the cost of care is from thousands of providers across the country. And you can go to their website, you can Google Genworth cost of care. It's great. It's you can type in your zip code and it will bring up what the average cost of care is in your area. I'm going to show you, though, in a moment, it's a little off. So these are the average costs of what Genworth says is in your area. And so you might be saying, yeah, these look a little low from what I'm hearing and what I know of in Montgomery County, Maryland. And you're right. So according to Genworth, these are the costs that they're saying home care is and assisted living and skilled nursing. I just want to make a few comments about some of these and just some of trends in care and senior living that we're seeing before I go into some actual costs in your area for you. First, home care, hourly rates are going to vary. And so, Genworth says it's $33 an hour. You're going to see it's a lot more than that in your area. But they do say that the average usage when someone does need home care is about 6 hours a day. So it's about 44 hours per week. This rate, though, has skyrocketed since COVID. So for most areas now, the cost of home care has now exceeded the cost of assisted living for the first time ever. So it is now more expensive to receive home care in a lot of areas in the United States than it is to move into assisted living, which is the opposite of everything I've ever been told my whole career, right? It's always been more expensive to move into assisted living. Now it can be quite the opposite. And the reason for that is staffing, which you may know. It's very hard to find staffing to come into the home to care for people. Assisted living, this type of care, again, is the first tier of that facility-based care when someone is moving from their home into a community. This type of care, the cost can vary on the level of care that you need. So it's very important to really understand contracts if you're looking for yourself or a loved one, because if you see a base price, there may be additional costs tacked onto that, as well as uh, you know, different rooms, square footage. That's all going to vary the price as well. Um, Skilled nursing, obviously, is the most comprehensive care that someone may need. Someone who may really be dependent may need a registered nurse because they have complex medical issues, that type of thing. And this is just a semi-private average here. I will tell you, most places now have private rooms because most people don't want to share rooms if they don't have to. So of course that rate's going to be a lot higher. And what we are seeing with a lot of communities, especially in CCRCs and life plan communities, that skilled nursing is really, they're dwindling the number of beds. If new communities are being built, they're not building skilled nursing because people are really outright refusing to go to skilled nursing, that they're meeting their needs in assisted living. And they're paying for extra care in assisted living to avoid skilled nursing. And so you'll see that more and more, especially with any new buildings being built. So let's go to the actual cost in your area. And the great thing is, if you did not know, legislation last year passed that every CCRC or life plan community now has to post their disclosure statement on their website. So what that means is their pricing is now like common knowledge. So if you go to any CCRC website in Maryland, you should be able to find their disclosure statement. And in that is their pricing for all their levels of care, including all their independent living, assisted living, memory care, and skilled nursing. So what I did is I did some research and looked at some CCRCs in your area and pulled some of their actual costs of their different levels of care. So you'll see that here. And I called some people up too to see what their home care rates were. So home care rates in your area actually are closer to about $42 an hour. So almost $10 more than what Genworth is sort of averaging. So instead, that monthly cost is more than about $7,600 a month. So if you needed about the average, you're looking at closer to $92,000 a year for that type of care. Assisted living in the area is well over $10,000. That's just for the base rate. In a studio size, it goes a lot higher. I saw rates all the way up to $17,000 a month. So you're looking at well over $123,000 a year for assisted living. Memory care is a type of assisted living, but for individuals with memory impairment, receiving specialized care, so it's just a little bit more expensive. Those rates, $12,000 or more a month, so a little bit more than $146,000. Of course, skilled nursing care. Again, most of the places I looked only had private rooms, so you're looking at over $18,000 a month for skilled nursing around your area. That's this is like Connecticut pricing. So when I told my friends in Connecticut what the rates were, they were shocked, especially because here in Baltimore, it's not as much. So you guys are so close, but the costs are so much more. So it was definitely something that was a little bit surprising to me, how much more that skilled nursing rate was. So those are sort of the costs that we're up against. And sort of, we always knew this. We always knew that long-term care was expensive. And so how can we help pay for this? And how can we help people stay at home? And so that's really how continuing care at home was born, was we needed an alternative. And so over 35 years ago, that's what Friends Life Care was sort of tasked with. They were provided grants by several organizations to come up with an alternative to CCRCs and long-term care insurance. They said, can we provide similar services to that of a continuing care retirement community, but to people in their own home, and provide some sort of financial protection that people can get with long-term care insurance. And so continuing care at home was born back in the late 80s. So believe it or not, over 35 years ago. And Friends Life Care is still in existence today. They are in Philadelphia. They have over 2,500 members. So very successful program. And so continuing care at home is, an alternative way to really self-fund long-term care and help you age in place. You may also hear the term when we talk about continuing care at home as a CCRC without walls, because we are providing similar services to of those that you would receive in a retirement community, but bringing them to you in your home. Some may say it's sort of similar if you're familiar with the types of contracts in a retirement community, sort of similar to that Type A contract. Some people will say it's long-term care insurance on steroids, because we really do provide a lot more coverage than typical long-term care insurance policy. And as I sort of explain the benefits, you'll see that. And even though this program model started over 35 years ago, I say now there are about 40 programs across the country, which I feel like there should be a lot more. But the concept recently, since COVID, I feel like has really been growing. And in the last year, there has been more organizations looking to open one of these programs. There's been some barriers in states with legislation and that type of thing, sort of like we have here in Maryland, which has been sort of preventing some organizations from opening these programs. We have organizations that are helping us. All these programs are part of nonprofit organizations. It's really part of our mission to be able to offer this to help people stay in their own home. Each state, it's regulated on a state-by-state basis, so every state is regulated differently. And here, this map, I just wanted to show you all the little flags, and this is a little outdated, so it's not perfect, but it's pretty close, shows you where programs are throughout the United States. And so you'll see that most of the programs are in the Northeast. Population density is greater there. There's also a lot more continuing care retirement communities. Most of these programs are tied to an existing continuing care retirement community. And so, that's important. Pennsylvania has the most continuing care retirement communities in the country. They also have the most continuing care at home programs. So that's not a mistake. Like I said, Maryland, we're the only ones, but we're surrounded by a lot of programs. Florida now has 2 programs. There's actually one in Orlando that just opened up. And so the West Coast, it's more regulations that's preventing programs from opening. Arizona is really the only one out there that has one, but I know an organization in Colorado that's working on opening a program right now. So a lot more to come, I think. And just to let you know, we are in Maryland, we're one of the only states that has separate legislation and regulation for this type of program. It does create different barriers for urban organizations to open and operate in the state. Um, and we are overseen and regulated by the Department of Aging. But our current administration has been very supportive of the model because it is in line with the Longevity Ready Maryland initiative because it helps older adults plan for the future. And we've made some legislative and regulatory changes to help us operate in Maryland. Some are actually occurring right now. So that's exciting. Our program, Leslie Secure Cares, we are currently, as I mentioned, the only at-home program enrolling members in Maryland. Currently, because the way the regulations are written, we're licensed by county currently. So we are currently eligible to enroll members in Baltimore County, Baltimore City, Howard County, Harford County, Anne Arundel, Carroll, and in the Eastern Shore. Regulatory changes, we're hoping that will take place very soon, will open up the entire state for us. And here, I just wanted to provide you the regulations and legislation that we have in case you're interested. And really what it boils down to is these are in place for consumer protection. And coming from South Carolina, where we had none of this, I think this is great, especially selling this program, that it provides that layer of consumer protection for our members, especially when it comes to the finances, that I have to carry a certain level of reserves. And so that can ensure our solvency and that we're going to be here when our members need it. That is very important. So how does all of this work, right? Again, the most important thing for our program and any continuing care at home program is you have to join these programs when you are healthy and when you are independent. And so again, it's a program that you join when you're planning ahead. And just like you purchase long-term care insurance when you're healthy and independent, again, we're more lenient than long-term care insurance. We understand that as people age, you might have chronic health conditions. That's okay. It's more about how you're managing those conditions than about the conditions that you have. So we really look at the whole person. And so it's a lot, the underwriting is a lot different. I will say that. It is a membership-based program, so individuals pay a one-time entrance fee and an ongoing monthly fee, and that covers an array of different services. And I'll go over what those services are here in a moment. But the program really focuses on proactive health and wellness, and really to reduce the need for facility-based care altogether. And we do that through our care coordination, our wellness coordination. It's central to our model. And what that does is it provides not only advocacy, but also navigation through the healthcare system and access to any services that our members need. It is a relationship centered service and a person-centered service. And so I'm going to go a little bit more in depth in this in the next slide because it is so important, this care coordination, wellness coordination part of our program. But we get to know our members while they're healthy, while they're independent. So if something does happen, we can go to the hospital and seamlessly advocate for our members and show up at the hospital as not a stranger. Our members know us, we know them, and that we can make the appropriate phone calls to their families, to their loved ones. We can arrange for services that they need, or we will know that they have a dog at home that we need to find care for, or that we need to make sure that their daughter in California is notified. Little details like that that other people may not know. And so it's really important, that relationship piece for us. Um, and really important, there's no waiting periods for our members to get service. That as soon as one of our members needs something, that we are in coordinating the service and paying for the service that they need. So we are a payer of long-term care service, and our benefits last a lifetime. So if someone is in the unfortunate circumstance that they need care for 5, 10, or 15 years, we are coordinating and paying for that care for however long they need it. And I just want to, again, just focus on this wellness coordination. And again, it's a relationship-centered, person-centered approach to supporting aging in place through the aging journey to the end of life. That's really what we're doing. It's holistic because we focus not only on your physical health, but we look at your environment, your social health, your spiritual health, emotional and intellectual health. And we do that through assessment. We get baseline, and we do the same assessment every year. So if stuff, goes off your baseline, we put interventions in to hopefully get you back to baseline. That relationship really builds trust, which results in better communication and honesty, which can really provide you better care and gives you promotes independence. That person-centered approach is really about promoting the quality of life, giving you the control that you want throughout your life, no matter what may change. And again, this is a lifetime program. We're going to be with you no matter what happens. And so besides that wellness coordination piece, which is very big in our program and is a big selling point because a lot of our members may not have family or may not have family nearby. So we somewhat become an extension of family for a lot of our members. But we also include a lot of initial supports and services that start from day one of membership. And that includes a personal emergency response system, access to telehealth, medically necessary transportation, home safety inspections by occupational therapy, and recommendations. And then, of course, most importantly, we include long-term care services. So if someone needs home care, all the way from companion services to skilled nursing in the home, adult day services. And then, of course, we talked about this being an aging in place program, but sometimes the best environment for someone is going to be in a community facility setting. So we do coordinate and pay for assisted living, memory care, and skilled nursing. And a great thing about our program is that our members, we do set up preferred providers with communities. And so we will get some preferred pricing and placement, but our members can go to any community that they wish. We're going to vet it, make sure they provide good care, perhaps warn them if we find something to the contrary. But our program is also portable throughout the United States. So if our members are happy where they're living currently, but if they need assisted living and would like to go closer to where their daughter is living in Florida and want to go to assisted living facility there, our plan will follow them. Our benefit will go further in Florida than it will here. Cost of care is a lot less expensive, or even South Carolina, where I came from. And so that's a nice benefit too, is that if you decide to move from the area, the program will go with you. Eligibility, just to give you a brief overview, here in the state of Maryland, this is sort of by regulation, is that it does begin at age 60. For us, right now, our youngest member is in his 60s. Our oldest member is actually 92, and she passed medical. So that is possible. So when people ask me about the medical criteria, you do have to live in the service area licensed by the Department of Aging. And I talked about being relatively healthy and independent. Really, like the only disqualifiers that I tell people, you cannot be in need of services right now. So if you're already in need of home care, probably not appropriate. And if you have a dementia diagnosis, unfortunately, we cannot take people on to the program. However, we do have a care coordination program that I'm going to go over here in a moment that can provide services. We just are unable to pay for the care. And so that's why too, it's very important to get into these programs while you're healthy and independent. You never know what could happen next month or next week. There is some financial eligibility, and you're going to maintain your medical insurance as well. And right now, these are the contract options that we have. I will say we're expanding these options, and I'll talk about that in my final slide. But these contract options include all of the same services. The only difference between these contract options is the amount that we pay for care per day. So basically, all of them cover all the initial services, the wellness coordination, home care, assisted living. The only difference is the amount of benefit that we'll pay per day. And then if there's an overage, that the member would be responsible for that. And some of these plans would be a good supplement to someone who had an existing long-term care insurance policy. We offer an array of different ways to pay for our program. And the way that people pay for this is really determined by what their tax professional tells them, because I will say that our entrance fee and our monthly fees are considered prepaid medical expenses and may be tax deductible. And so that's been something that we always encourage our members to talk with their tax professional about. And so some people choose the lump sum payment for the entrance fee. Others choose to do deferred payments over 3 years, interest-free. That has been actually a more popular option the last couple months. And just to give you an idea of pricing for our Chesapeake option, which is our right now the top plan, which provides $370 a day of benefit for a 75-year-old, which is the average age that someone usually joins one of these programs. For a single individual, there are discounts for people who are part of a couple or living under the same roof. And our pricing is based on your age at enrollment and the contract option you select. So the older someone is, the more expensive the entrance fee is going to be. And then the monthly fee is just based on the contract. And so this example here for our Chesapeake, that entrance fee for a 75-year-old is going to be around $100,000, and that monthly fee is going to be $712. Again, you're getting a lifetime of care for $370 a day, and we do have built-in inflation protection. Just quickly, how it works with long-term care insurance, and we do offer discounts based on your insurance policy on our monthly fees if you have an existing insurance policy. But long-term care insurance can be very limited. It usually has an elimination period or waiting period. And we are there from the very beginning. And what people don't really talk about is we cover a lot of short-term services. So like when you have a joint replacement procedure or even like a carpal tunnel, where you might just need a little bit of care for a little bit of time, that can make a huge difference. And so we're there for those things as well as those long-term care services. Long-term care insurance is really there for those long-term care experiences where you need care past those 90 days. You have to be really need substantial help with your activities of daily living. And they have limited coverage, maybe just 2 or 3 years, that type of thing. So we really circle around your policy and fill in the gaps. And this is that care coordination program that I mentioned before. It really is ideal for people who may not medically qualify, but also people with excellent long-term care insurance. This has been a very popular option in the Baltimore area with. I run into a lot of people who've got, I don't know who was selling long-term care insurance in Baltimore in 2001, but they sold some killer plans, like lifetime benefits, over $400 a day. So people don't need our financial protection, but what they really want is that advocate. And so that's what they're getting with this plan. And so this plan just has a flat entrance fee, no matter your age, and monthly fee. And so this plan technically isn't under the auspices of MDOA, but still part of our program. So I can technically offer this to Montgomery County now. And I just want to point out some outcome data. And I work with Leading Age, which is a national organization that represents, it's an association for nonprofit senior care providers. And they have a research center that's associated with UMass Boston. And every year we collect data from continuing care at home programs across the country. So I said there's about 40. And the reason I know that and the reason I know where all the programs are is because I collect all this data. And so I work with them, and every year we send out this survey and we collect all this data. And the most interesting data that we collect is about outcomes and care utilization outcomes. And what we find continuously, year after year, is that continuing care at home members across the country show low utilization rates of skilled nursing. And so this past year, we had less than 1%, actually 0.6% of continuing care at home members across the country were residing in skilled nursing homes. That's extremely low compared to the general population. And in assisted living and memory care was also low at only 1.2%. However, I had about 10% of members receiving home care. So what that tells me is that we are providing care to our members. We're just doing it at home where they want to be, which is great. So we're keeping people out of skilled nursing, keeping people in their homes, and providing them the care services there. So we're really carrying out what we said we wanted to do, which is help people age in place. And I don't know of anyone who wants to go to a nursing home. However, I lied. Only one person has ever told me they wanted to go to the skilled nursing home, and that was because her other alternative was she was going to go home to live with her daughter-in-law. And she didn't want to do that. And I get it. In-laws, not so great, right? But other than that, most of us don't want to go to the nursing home. So, our programs really have helped people stay out of those nursing homes. Hospital readmission rates, we've also been able to really cut in half compared to the general Medicare population, which is amazing. And I think really what we're trying to get to next and examine is it that care coordination, which we really think it is, and working with our members one-on-one and advocating for them and providing that more proactive care right away and being involved. So some great data, and we continue to collect every year. And some other data that Varsity Marketing collected last year was they did some focus groups, current members, and asked them about why they joined continuing care at homes. And these are some of the main themes. People wanted to stay in their current house, and they wanted to get the support they needed if their health changed. They didn't want to be a burden on others, And they wanted a reliable source of care instead of having to rely on their families. This is actually a quote from someone in the study that they were concerned about living in a life plan community. They wanted to avoid it. They like communities, but it's not for them. They hear about cliques and it seems like living in dormitories in college. I like to have my activities and choose to when I eat dinner. I don't need that structure. And so we like to help people keep their independence and autonomy throughout their life. And I just want to point out, David had mentioned before, Goodwin Living at Home, right over the border in DC and Northern Virginia. Very successful continuing care at home program, started about, I think, 10 years ago now. And this is Shannon Bishop's contact information. If you are living in DC or Northern Virginia or have someone who is and are interested in continuing care at home or learning more about, please feel free to reach out to her to learn more or visit their website. They have very similar, offer very similar services to what I just explained, maybe just a tweak different, but very similar. And so that's what you'll find in these continuing care home programs, all very similar services, maybe just very small nuances different, but it's very comparable. And so what's next for us? And so very excited that the regulatory changes are on the way to being finalized. As I said, I rewrote some regulations so that we no longer will need to be licensed by county. And so those should be finalized here, hopefully in the next month. And so that will be allow us to be able to operate in Montgomery County. And then because of the cost of care in your area, we are in the process of adding additional plan options to accommodate that cost. And also adding some additional plans for consumer preferences. So looking into home care only options and hitting some different price points. So I'm excited working with our actuaries on those plan options and maybe conducting some focus groups as well. So also if you're interested in participating in any of those focus groups, would love to have emails of individuals. We're also exploring partnerships with life plan communities, CCRCs in the area, to enhance our member benefits so that our members may be able to use amenities at the different communities and also have those care options for assisted living, skilled nursing, those types of things. And we're also would love to explore how we can collaborate with the village networks, possibly being able to offer discounts to members of villages because of the benefits that you receive from the village network. So those are all things that we're working on, in the coming months to get ready to officially launch in Montgomery County and offer our program. So with that, I thank you, and I'm seeing the chat explode, George. So I don't know how
Okay,
many questions we'll be able to get to.
well, we're going to try to get through them as many as we can. And Amanda, first, I'd like to say thank you very much. It was an excellent presentation, full of all kinds of good information, and certainly eye-opening for me. So with that, I'm going to stop the recording, and then we will try to get through some of these comments and questions.